Welcome to the Preventive Cardiology and Apheresis Clinic Dietary Education. There are 4 food options that you can add into your diet that have been proven to reduce your LDL or lousy cholesterol. The first is through a plant-based margarine called Benecol, which contains plant stanols. Plant stanols are found naturally in many fruits, vegetables, and grains, but only in small amounts. It takes 2 grams of plant stanols per day to actively reduce the LDL. In order to assist us in getting the amount we need, chemists have added these plant stanols to Benecol margarine. If you can use 2 to 3 tablespoons of the margarine per day, you can reduce the LDL by 10 to 15%. The second food you can introduce is 1/4 of a cup of walnuts or almonds daily. This can lower the LDL another 8 to 10%. Next, a diet high in fiber, at least 25 grams per day, can reduce the LDL an additional 8 to 10%. Foods typically higher in fiber are fruits, vegetables, nuts, legumes or beans, and whole grains. You can even add a fiber supplement to boost your daily fiber intake. The fourth and final option to add to the diet would be flaxseed. The whole seed itself passes through us undigested, so you need to use the ground flaxseed. 3 tablespoons per day can lower the LDL an additional 10 to 12%. Make sure you store ground flaxseed in the refrigerator or freezer, as the oil in the seed goes rancid quicker at room temperature. You can pair flaxseed with yogurt or fruit smoothies, with hot cereal such as oatmeal or cream of wheat. You can sprinkle it over salads or soups for a crunchy texture. It is recommended to limit how much sugar you consume in your diet. In order to do this, we recommend that you choose foods and drinks with little or no sugar content. If you would like to use a sugar substitute or artificial sweetener, your best options are stevia, Truvia, or Splenda, otherwise known as sucralose. When you are shopping and reading labels, we recommend that you follow the sugar rule. For those that are diabetic, you should consume no more than 4 to 6 grams of sugar per serving. If you are not diabetic, we recommend that you keep the sugar to less than 10 grams per serving. 1 level teaspoon of sugar is the equivalent of 4 grams. Therefore, if something has 12 grams of sugar, 12 divided by 4 means that that serving has 3 teaspoons of sugar. So again, non-diabetics should consume no more than 10 grams of sugar per serving, and diabetics no more than 4 to 6 grams. It is recommended that you eat at least 3 to 4 servings of vegetables a day in your diet. The more color and variety in your vegetable choices, the better. However, we do recommend that you limit your starchy vegetables. Starchy vegetables turn into sugar and can elevate your blood sugars and triglyceride levels. Carrots, peas, lima beans, corn, beets, and white potatoes are your more starchy or sugary vegetables. You should have no more than a total of 3 per week from this list. A sweet potato or a yam would be a much better choice than a white potato. Serving sizes of vegetables are considered as 1 cup of raw, 1/2 cup cooked, or 1/2 of a potato. Your fruit servings per day should total no more than 2 to 3 and should be either fresh or frozen. A serving size of fruit is considered to be 1 piece of fruit. That would be something like an apple, an orange, a plum, a pear. 1 cup of berries such as strawberries, blueberries, raspberries, blackberries, or 1/2 of a cup of other fruit that you would typically cut up, such as watermelon, cantaloupe, pineapple, etc. You do want to limit your high glycemic or high sugared fruits such as bananas, grapes, pineapple, mango, kiwi, and watermelon to no more than 1 choice daily. A serving size of a banana is only 1/2, and a serving size of grapes is only 10 to 12. Although we don't typically recommend fruit juice in your diet, studies have shown that purple grape juice may be beneficial in raising your HDL due to the resveratrol in the purple grape. If you do want to use this, we recommend that you choose a light or low sugar fruit juice and consume no more than 4 to 6 ounces daily. The terms carbohydrate and starch are used synonymously in the diet. Our diet recommends that your carbohydrate choices be the healthier, high-fiber starches and that you consume no more than 2 to 3 servings daily. Keep in mind that a serving size of bread is no more than 2 slices per day, and a serving size of a starch, such as pasta or rice, is no more than 1/2 cup cooked. Some of your high-fiber starch choices would be 100% whole grain or whole wheat bread, whole wheat pastas, wild or brown rice, 100% whole wheat couscous, barley, oats, or other ancient grains such as quinoa. We realize that gluten-free and renal patients sometimes need to make different choices. If you follow a gluten-free diet or your kidney doctor has told you not to eat the whole grains, you obviously need to follow those recommendations before ours. Remember, a good source of fiber should always have 1 gram of fiber for every 10 grams of carbohydrates. For instance, if a slice of bread has 17 grams of carbohydrates, it should have at least 1.7 grams of fiber. Our recommendations for dairy in the diet is that you consume no more than 2 to 3 servings a day. Remember, dairy provides us with fat, and fat can raise the LDL cholesterol. Low-fat dairy such as 1 or 2% milk, 1 or 2% cottage cheese, not 4% as this is whole milk cottage cheese, and low-fat or reduced-fat yogurt are some of your options. Greek yogurt does give us more protein than regular yogurt, but no matter what yogurt you choose, remember to look at the sugar. Not all of your dairy options need to be fat-free. Remember, as they remove the fat from something, it loses its flavor. So to compensate, they add more sugar or more salt to enhance flavor. Therefore, as you trade off the fat, you gain more sugar and more salt. By choosing low-fat or reduced-fat dairy, you're getting a better balance of the sugar to salt to fat ratio. If you enjoy almond milk or soy milk, we recommend that you choose the plain, the unsweetened, or the vanilla varieties. The other options out there can provide too much sugar content. We do recommend that you limit your milk consumption to no more than 8 ounces daily. No matter what milk you choose, whether it's fat-free, 1% or 2%, they typically all have about 12 to 13 grams of sugar per 8 ounces. Cheese is very high in saturated fat and again can raise the LDL or lousy cholesterol. We recommend that you eat a very limited quantity of cheese and try to keep it low fat or reduced fat, no more than a 1 to 2 ounce serving per day, which is typically about 1 slice of a deli cheese, 1/4 cup of shredded cheese, or about 3 to 4 1-inch cubes of cheese. Protein is a necessary component of our diet as it repairs damaged cells and builds new ones. However, some protein can be a significant source of saturated fat and therefore raises our LDL cholesterol. We recommend that you eat no more than 2 to 3 servings of 3 ounces of lean meat or 5 ounces of fish daily. There may even be times where we ask you to scale that back if we need to further reduce your cholesterol. It is recommended to have fish 2 to 3 servings weekly. The only fish not recommended is tilapia. Fish gives us a significant source of omega-3s, which are very heart healthy. However, tilapia does not provide omega-3s. Rather, it contains omega-6s, which have not been found to be beneficial for our heart. Consume red meats, pork and beef, no more than once or twice per week. Enjoy more white meat, chicken and turkey with the skin off, venison, or other lean game meats. Incorporate legumes such as beans, lentils, or chickpeas several times per week. They provide us with a significant source of protein and fiber. We recommend that you limit egg yolks to no more than 3 per week. Egg whites or egg substitute are unlimited. As we mentioned earlier, a 1/4 cup of walnuts or almonds are very healthy. Peanuts, pecans, and pistachios are also beneficial, but no more than a 1/4 cup serving per day. Remember, almonds and walnuts are the best for reducing the LDL cholesterol. Natural peanut butter is recommended over regular peanut butter because it does not have hydrogenated oils, which give us trans fats. Trans fats are the worst fats we can consume in our diet. A lot of time, trans fats are hidden in foods by the term hydrogenated oils. You have to look in the ingredient list to see that they are there, as most products will list it as 0 trans fats on the label. Remember to keep peanut butter to no more than 2 tablespoons serving daily. Healthier sources of fat in the diet can provide us with poly and mono unsaturated fats, which are beneficial in moderate amounts. A good example of this would be avocado. Another example is olive oil, and this would be our preferred oil in the diet. However, olive oil does not withstand high heat and should not be used at temperatures more than medium. Canola oil would be a better choice in this case. We do not recommend coconut oil as it is a significant source of saturated fat and will definitely raise the LDL cholesterol. Butter should be limited to no more than 2 thin pats per day. Smart Balance, Promise, and Olivio would be 3 non-trans fat margarine options that you can utilize in place of butter. However, remember, earlier we spoke of Benecol, which gives the additional benefit in lowering the LDL cholesterol due to the plant stanol content. Although your salt intake does not have any impact on your cholesterol, we still recommend that you limit to no more than a 1,500 to 2,000 milligram intake per day. 1,500 milligrams is reserved more for the person who has uncontrolled blood pressure or those with congestive heart failure. 2,000 milligrams per day is more recommended for the general overall cardiac patient. Remember to read all your food labels. There is a lot of sodium, especially in processed foods. We do not recommend that you add salt at the table or with cooking, or if you have to, just minimal amounts. Try to use salt-free seasonings or other salt substitutes, fresh garlic, fresh or dried herbs, vinegars, or anything that can provide flavor without adding salt. And try to stay away from as many processed foods as possible. Anything that comes in a bag, a box, a can is going to provide you with more salt. Try to shop the perimeter of the grocery store where you can get more whole foods, such as your fruits, your vegetables, your lean meats, and your low-fat dairy. In conclusion, the success to cardiovascular health really comes down to a balance of 4 components: a well-balanced diet, an exercise program of at least 30 minutes per day, 5 days a week, the right medication, and weight loss, if applicable, is a winning combination.